Hello, everyone. Welcome. We are waiting for just another minute so people can join. We still have some people coming in. Sorry. We're going to get started. We are waiting on one of our discussants who may be able to pop in just a little bit, but in the interest of time. Words matter. Words change the tone, the frame, and behavior, and words can change practice. The adage of sticks and stones may break my bones, but words will never hurt me isn't really true, because words can hurt. Words can also heal. I want to welcome everyone to the Words Matter series, where we engage in open and authentic discussions about the impact of common terminology used in child serving systems with those that are directly affected by that terminology. Our goal is to illuminate how the terms we use can influence perception, approach, and practice, as well as explore alternative language and terminology as a means of intentionally shifting how we view and interact with youth, families, and with each other. Today, we're going to be exploring the use of the terms client or consumer. So before we begin, please take a moment to consider something. Think about what comes to mind when you hear the term or think of who client or consumer is. There's going to be a link in the chat box. Eve is going to drop that in there to a Menti poll for you to answer that question. And if you would please just go to menti.com and put in the code that will be in the chat box and respond to that. We're going to be able to see a word cloud that comes up. Everybody can see the link. There we go. If you go to menti.com, use this code right here, 5282-5394, and then just answer, what comes to mind? So this is the wrong one, Eve. This is the second one. There we go. Okay. Same code. Same place. What comes to mind when you think of client or consumer? And we'll get, I see, can you send the link to the second one? The second one will be coming up. The link, if you go to menti.com, use the code 5282-5394. So what's popping up is a person receiving services, someone paying me. Oh, that's interesting. Exchange, user. Someone who is sold to, people in my care, someone in need, someone we serve. User still seems to be one of the more common things that come to mind because that one is in larger font, along with person receiving services. Participant, member, trauma. Someone we serve or help, receiver. Youth is getting, that term is getting a little bit larger in font, so more people are using that one. Person in need. Them. Receiving a service. Okay. All right, thank you. You can continue to add something there. I think we see what the bigger ones are. Under the care of, transactional. Someone put the code in. Person with a want or a need. Okay. Thanks, Eve. All right, so let's talk about how the use of these terms client and consumer impact youth and families. We have joining us today, we have Dylan Mason, a young adult from Pennsylvania, and Bianca Martin of Virginia, who's both a parent and an individual living with mental illness. I'm hoping that we will have another parent from Ohio join us if she's able to, and if so, we'll add her on. So thank you all for being here and for sharing your experiences and your perspectives. Let's get started with kind of a first question. In the child and youth serving systems, we often refer to individuals who are receiving services as clients or consumers or patients, or there may be other terms. I've heard before the term revenue stream in reference to families that are receiving services. So while that type of terminology has been accepted under the medical model in behavioral health, it may not be how youth and families would like to be referred to. Those experiencing emotional or behavioral challenges themselves, or who are supporting a child or a youth with these challenges, may define client or consumer differently based on their lived experiences in service systems and in public settings. So Dylan, if you don't mind, let's start with you. From a young adult perspective, what does the term client or consumer mean to you?
Yeah, so the term client, to me, that's someone who's receiving services from another human being that's not quite physical. That's a life coach or a therapist or like a lawyer. That's what comes to my mind when I think of client relationships. When I hear consumer, I'm thinking of a actual physical product I'm buying. If I'm going to a store and buying something physical that I can pick up and take home. I wanted to take it further and say patient, because patient is something that's really big that I hear often. And when I hear patient, I'm thinking of someone who is injured or has an injury and is in the process of healing that. That's how I see it.
More physical health is what you think of when you think of patient.
Well, I also think of patient in terms of mental health, because I see a lot of mental health as a injury as well. You know, trauma is like an injury to the brain. So so patient makes sense to me when it comes to mental health.
Bianca, how would you define client or consumer in your experience?
Thank you all for everyone that's here and joining. And Dylan, thank you for sharing your perspective. From me, I would say, I've always been fascinated by mental health and psychology. And I remember taking a class. I don't recall how young I was, and it was probably about 23 years ago. And it was a psychology class, and they talked about the impacts of using client versus patient while you're being a client, and that it can impact the words can impact the relationship with the quote unquote patient versus the therapist, whether or not they be a PhD or an MSW. And so I remember the first time I ever had an appointment, because I've been in and out of therapy probably for that, at least 20 years. And the first question I had for the therapist was, and it was a male, I said, what do you refer to your patients or to the people that you serve? And I remember he got really squirmy while I was asking him this question. And then he got kind of like sweaty, it looked like. And then he responded, and I honestly cannot remember what he said, because I think I blocked out because of how his whole demeanor was towards me of even asking this question. And then I saw him start writing down stuff. He started writing stuff down. And of course, I'm like, oh God, it's only been 5 minutes and he's writing something down, because I'm questioning him of what he refers to me as. But I thought just the relationship is important, no matter what relationship we have. But if I'm going to be telling you some very intimate, private details of my life. And if I'm going to be telling you these things, I want to see, am I someone that is just another number or dollar sign to you? Or am I someone that you're genuinely willing to help? And am I a patient in your eyes? Or am I just, like I said, am I just, paying for your BMW? Am I just your consumer? Am I just your client? Am I just your number? Whatever you want to, even a quantity of clients that you have, you need to see a certain amount to get a certain revenue that day. So, and that's my lived experience as far as what client and consumer means, and that's in the mental health forum. In other forums, I also see client as a kind of an icky word as far as, are you a client of some inappropriate services, like going to a strip club? They call them clients there. So if I'm being a client, if someone's calling me a client, and that's my perspective or lived experience of it, it can feel uncomfortable as far as, why am I being called a client? I don't know.
What about as a parent? Your child being called a consumer or a client. How would you define it in that case, from a parent perspective?
Well, I've had several in-home providers in my home in the last couple years, and that's what they do refer to my child. My personal experience is that's the protocol.
Mm-hmm.
So if they're not also, it is part of HIPAA as well. So opposed to writing the quote unquote client's name, they have to write client up in the documentation opposed to the child's name to protect the identity of that. So it does make sense in that form. And I know we're going to later on discuss how we can kind of change the wording of that. And then I'll share my lived experience in that. But I feel like it's just protocol, and it is from the medical field, it's the expectation.
Mm-hmm. Okay. Yeah, I'm not sure that we as mental health professionals have really given a lot of thought to using these terms when we're referring to the youth and families with whom we work. And so you saying that there had been a conversation about that, at some point you had been part of. I was glad to hear that. I know in my master's program, we didn't really talk about that. It was always client. So I don't know that we really do give a lot of thought to that. We should, because youth and families may feel or be affected differently when this term is used about their situation, their experience. Like you said, sharing very personal information, the tone of and the way in which a term is used can really impact people differently. So what impacts have you seen or experienced yourself based on the use of these terms, the use of client, the use of consumer, or when something else is used? And that's from your perspective individually and just, what you've seen in your work or in your community. Either one of y'all can start.
Do you mind if I speak on that?
Go ahead.
Okay. Well, I've been in the mental health system in and out for many years. I've been called a client, a patient. I've never been called a consumer. But when it comes to outside of the actual facility I'm in, I have been called a mental health patient, a mental patient, many times in a derogatory sense. And I cannot stand being called a mental patient, and it takes all accountability away from that situation that a person has been in. It's 100% like you're calling someone a mental patient, it's a derogatory term in my opinion.
Negative connotations and feelings to it.
Yes. Like I was at work not too long ago, and a coworker said that like, oh, I'm done having relationships with mental patients. Like, you know nothing about me, and you're trying to make a friendship with me. All right.
Mm-hmm.
So it definitely offended me, right? So I understand technically a mental health patient is someone who's in the hospital, you're being healed for an injury or a traumatic experience, and technically it works, right? But in my opinion, if you're a mental health patient, then that can be used against you outside of the system. That can be used against you because it takes away your accountability. People say it as a term of, oh, this person's crazy. This person doesn't know what they're talking about. And that has been used against me personally by a friend of mine who knew that I was in a mental hospital before, and they made a post about me saying that, like, oh, he's a mental health patient and you can't really believe anything he's saying, when I was trying to share some aspects of my story that involved him. Um, so I really don't like the term patient when it comes to bringing that outside and labeling people that. And I, for one, I respect Bianca's her opinion and where she's coming from. I would prefer being called a client over a patient.
We haven't lost Dylan. So Dylan, you're frozen. You may want to turn off your camera so you have better bandwidth.
Everyone knows that you're a mental health patient.
So
But
Dylan, you missed part of that because you froze.
Okay.
Yeah, I'm sorry.
It's
Can
okay.
you repeat that last part of what you said? And you may want to turn off your camera. You'll get better bandwidth.
Oh, okay.
I think you froze again.
I accidentally muted myself.
Oh. Yeah, maybe that will help with the connection a little. Dylan brings up a really good point about how someone refers to you, or, it's really kind of a label, can impact you outside of the behavioral health system. I mean, we know that, I know from my own personal family, people who have been through the Army and received trauma, in combat, and if they access services they need for that trauma, it can keep them from getting jobs, or they can lose the job they have in the skill set that they have. It also can be used against you in court. It's been brought up before. Someone who went through something as a young person was brought up in a divorce later on, saying, oh, they have mental health issues. So it does have long-lasting effects, not just in the moment, but because it does have negative connotations, because we have stigma still around it. So Bianca, how does the use of this term impact you and your kids, and in your community?
I honestly personally don't prefer client or patient. I would just prefer to be called Bianca. And that when a doctor or physician is speaking to me, or whether or not they see the how they view me or how they refer to me, it's unfortunate, like Dylan was saying, there is that negative connotation, and then there's the stigma, like you said, of that you have been in a mental health facility, or you have been in, like me, been in therapy for 20 years. And it impacts a view of me. It impacts the perception of, well, this person must not be capable, or this person has a disability, or this person, they are a client, or that they're a patient because they're needing support. And eventually, I mean, all of the things that we're doing is in a movement in the correct direction of removing that stigma, removing the negativeness about a client versus a patient, or just that there's someone. I mean, when I look at myself and the impacts of what my work is, as far as my internal work and the therapy that I've received and EMDR and all of the things, I view it as this is healing. So as much as I'm doing the work to heal, I'm still viewed as a patient or client or a consumer, because I'm paying someone for a service. I mean, so it impacts when people may call us, a client or patient. It kind of sets the tone for their view of, or their thoughts about me in advance, or my son. And that's just
The
in my
interaction.
right? And it impacts the rapport. It impacts the rapport building and the engagement.
Mhm.
And I think that's the whole purpose I was making earlier is when I first met him, I wanted to know what he thought of me up front. You know, like, what do you see me as? Obviously, we can't be good friends. Like, we're not going to be friends, but I am going to tell you some really intimate details. But how do you see me? How do you see your patients? How do you refer to your clients? And it was just one of those things I wanted to know, you know, from that discussion that I had in a psychology class, is that it does make a difference on the relationship, and it can impact. If I feel uncomfortable with someone that I'm sharing these details with, I'm not going to be comfortable with some really deep-seated things that I need to heal.
Mhm.
So it could impact the treatment too.
Very true. Very true. I think just as a parent myself who has a child currently in therapy, I've been very impressed with the therapist. My child is very comfortable saying, yes, this is, you know, I have a therapist. But their therapist refers to them as, I work with young people. I work with young people and their families. And so, you know, it makes a difference. It doesn't feel like there's judgment, and it doesn't necessarily feel like there's more of a partnership. It's more of a relationship as opposed to expert, you know, and someone who needs help. It is more of a collaborative. It feels more collaborative to me, and that's what my child is as well. But they're very comfortable with that, and you have to have that level of comfort if you're going to make any progress. So
Excuse me, can you guys hear me now?
yes, yes.
Okay, I'm on my phone. Hopefully I don't break out.
A little bit of technical difficulties, but we're really glad you're back.
Okay, thank you.
Yes,
Do you mind if I try to reword what I was saying earlier?
I would love that. Please do.
Okay. So I'm not sure even how much you guys heard, but I was talking about how outside of the facility that mental patient would come back and bite me in the butt.
Mhm.
And not only me, but that's something that I've heard so many people say, just mental health patient as an inappropriate way, something to take away accountability. When I was starting to break up, I think I was saying that I really respected where Bianca was coming from, and just getting on, I heard more of her story and where she was coming from. And I definitely agree that client is also something that it builds a barrier between two people. If I had to choose between the both, I would only choose client because of the confidentiality. You know, like I could go to a different place and also be a client, and it wouldn't come back and people could say like, oh, he's this. But at the same time, I wouldn't be building a strong relationship with the people that are giving me services if I'm just a client to them. You know, if they refer to me as who I am as a person, it's more personal. We can grow more, and I'll be more comfortable sharing things with you.
Mhm.
A large part of like my therapy has been an uncomfortability between me and the person who's giving me services because I don't feel a connection, and I don't feel like they really are here to talk to me and figure things out. I feel like a lot of the time they are here to just listen to me and let me vent. Um, but that's something that even if I wasn't a client to them, maybe that would change. You know, maybe if they didn't see me as a client, they would see me as a person. All right, we're doing something different. Yeah, I think both of those words. I haven't really heard consumer that much when it comes to mental health services in or out.
Mhm.
But as far as patient and client, I feel like both of them really can put a divide between people and also outside of the system as well.
Mhm. Yes, all good points. What for both of you, what have you seen when that term's not used? When something else instead, whether it's just your name or like my example, you know, young person and families. Have you seen a difference, whether you've experienced that or someone else has told you, you know, I really like this person I'm working with. They treat me like a person, like an individual. It's a partnership, anything like that?
I have been called a young person, and in services, I've talked to people who refer to other people as young persons with experience, or something along those terms, and it's much more humanizing. It feels much more. There's more connection, and it just sounds more open-minded and loving. Like that's exactly what it is.
Mhm.
When you take away that label, you're making a lot more room for more humanity, for more conversation, for a lot more.
Good point.
I would agree. So I'm a certified peer recovery specialist. So I work in the mental health field now. And like I said, psychology has always been fascinated. I've always been fascinated by it since I was super young. I always knew I was going to work in the psychology field. However, I'm in a non-clinical role. Even though I'm a non-clinical professional working in the mental health field, I still am required to document. And when I document, I don't use client or consumer or patient because I'm not clinical. I use family or youth or the last name of the person that I'm working with. And I don't refer to them as patient, like the parent that I'm supporting. And I'm not calling them a patient, I'm calling them a parent because I am working closely with the parent. And then, like you said, Miss Sweeney, it is a partnership. And that's what I love about peer recovery work is that we are working with the family alongside them. And it is a collaboration, it is a partnership. And I'm not disclosing what they should do. I'm not telling, the team what they need to go do. I'm just kind of there as an observer, taking it all in, being a bystander of how can I support this family with resources or support, emotional support. And I also use the word family.
Mhm.
We've got multiple words. We use the parent, family, because it isn't just the parent or the child, or it's a unity of multiple dynamics there. Because a parent can be a parent, but they're a parent because of a child,
Mhm.
right? So it's a collaboration of the entire family that support each other. And so with that being said, that actually improves the relationship, and earlier when I was talking about what I wanted to be called, and I said, I just want to be called Bianca, Dylan hit it on he said, I just want to be a human.
Mhm.
I just want to be called an adult that's in services or care, or that's seeking treatment of something to be able to, there's no cure for CPTSD. There's no cure, right? But there's treatment, there is modalities, there's medication, there's peer support, there's therapy. There's lots of modalities that exist, but there's no cure. So when we talk about being in care, opposed to we're seeking, therapy, because there are so many words as well for therapy. It doesn't have to be therapy, because I also think there's a stigma behind that as well.
Sure.
That there's, you must have problems if you're going to therapy. Well,
Yes.
actually, right now I don't have any problems, but I am overcoming my past problems and challenges from my childhood.
Mhm.
We've all heard daddy issues, but what about the mother wound?
Mhm.
That's another word that we can't always blame one person or the other. As far as being raised in a family, there was two parents, and not everyone has a two-parent home. There could be one or the other. And so even if you were raised only by your mother, there still could be daddy issues, even if you weren't raised by your father, right? And so it's not, I'm going to therapy because I have problems. I'm going to therapy or I'm seeking care or treatment because I have not overcome certain things from the past. However, they can cause impacts of the relationships we have now.
Mhm. Very true.
Wow,
Yes.
I couldn't agree with you more, Bianca. That's really amazing. You said that. I was thinking the same thing when it came to therapy. When I was meditating on like the client consumer role, and the thought of therapy itself came into my mind as well. And I thought there's so much stigma just around that, just like you said. I actually had a question for you, and I was curious if in your life outside, if you've heard people make fun of others or try to take away accountability by using the term patient, by saying, oh, they're a mental health patient or anything like
Are you asking Bianca or me
that. Yeah,
or everyone
I
who's
guess
streaming or?
everybody now. I was asking Bianca, but everybody.
So I apologize, Dylan. What was the question?
If the outside of the service area, like in your daily life, have you ever heard someone made fun of someone else by saying, oh, they're just a mental health patient, or trying to take away their accountability? Is that something that you've experienced?
Honestly, because I am a mental health professional, a lot of the people that are in my lives, like in my life, know what I do for work. I've been in this work field for 3 years now, and I stumbled upon it because one, I have my own mental health challenges, but two, I have experience of my son being in the system. I'm in the mental health and behavioral health and special education needs. And so I have not heard, that would be a really sensitive topic if there was a person that was really demeaning to either me or my child. Those people wouldn't be in my life, because my entire life, my entire being, everything that I do is I work with youth in crisis, and I work with families. I support families in support groups, and then I work for Fairfax County Public Schools as an informal mentor with children. So like my entire life is kind of giving back to the community and just supporting families from my lived experience and being like a resource worker. So it's, I think
So
that
the people you're
I've
around are
been,
pretty supportive.
yeah, I've been really blessed in that sense, because I haven't experienced that. And I think I've also been given the advocacy skills to, if someone did speak of this manner towards me about my family or my son or even myself, that I have, problems or any of that thing, I would just be very, not going into their, because obviously if someone's going to make fun of me, I've learned over time that that's not about me.
But if they're using offensive language, you would know how to address it so that it's not offensive to you, or so that they know
Or
that.
yeah, I think it's about modeling. Yeah, I think it's about modeling the way. So opposed to getting offended, I would say, well, in my work, this is how we would word, or this is the language that we use. I have been told though that there was a family support partner like myself sitting at a table with system of care people, or professionals, I should say, and there was a conversation, and the professionals said they were referring to parents as those people, or something like that. Like the way that it was expressed was, and the family support partner really spoke up about it. Like those people you're talking about are me, because I'm a parent with children, with a child in care, and so you're referring to them, those people that have children in care, that's me that you're talking about. And I'm a family support partner, and I support families. And I really, and then she even said, like, that's not how we would address
Yeah.
a parent or a family. And so it is really about modeling the way and coaching our system of care partners that we work with. And sometimes you, as being an advocate, which I am a parent advocate, you kind of have to take one or two for the team occasionally and stand up, and people might not like you for sitting at that table, which you've earned the right to be there eventually, as far as speaking your voice and speaking your truth and your lived experience.
Wow. Thank you for telling me that, because that is something I needed to hear. And I've been really conflicted the past few weeks because, I'm 25 years old. I'm not a professional in the sense of I work around mental health all the time. I'm not a peer support specialist. So I'm working in restaurants. I'm working in like minimum wage jobs every now and then, and a lot of them because it's kind of hard for me to keep jobs. But anyways, the story I told earlier about a coworker who said that she doesn't hang out with mental health patients, that is a time where I should have been that advocate, and I should have said, hey, you're talking about me. And I wasn't able to do that in the moment. I was more like, kind of brushed it off. I took one to the gut and I kind of just brushed it off. A little bit later in the conversation, I told her, I'm like, yeah, like I speak on mental health, like I'm an advocate and whatnot. And she kind of knew then that like what she said might not have been cool, but I still didn't properly advocate for mental health patients. I didn't advocate for people who have been through the system properly, because what if another coworker of mine had been through the system and they heard like, oh, she doesn't mess with mental health patients, that could have made someone feel really bad. And I really like dropped the ball in my own opinion when it comes to advocating there, because it wasn't in a nice sense. And it was like referring to a large group of people, like that situation. So I really appreciate that story, because that's something that I want to take along with me and grow and be able to do from now on. I also wanted to ask Millie, like, Millie, has that been something that you've experienced in your lifetime? Have you heard people like try to take away accountability or make fun of someone by using the term patient, or even mental health, or like crazy,
Mhm. Yes, I mean, it's happened personally and it's happened in my professional life. And looking at some of the things that are coming in the chat, some of the things that we say because I started off as a clinician, some of the things that are said within mental health centers, we have our own jargon, but we also, and I'll admit, okay, so that's my kid who steals. That's, we're bad about labeling, internally, and then when we see you, we do something different. And it does dehumanize. I like what you said is the key here. We don't want to use terms that dehumanize, that affect those relationships. And so what you've been talking about is using this particular term can put up barriers, can lead to not being open in relationships that could be helping relationships, can jeopardize partnerships or make you feel less than. There's a lot of things, but you also have brought forward, there are other ways to do this. There are other ways to refer to those with whom you work. There are lots of different ways that you can document that are still respectful, that maintain confidentiality, that are HIPAA compliant, but that are also human. And I loved seeing, I was kind of watching the chat out of the corner of my eye. I love people saying that, even if someone goes and reads a chart and they're just about to work with you, how you write something down there can have that next person see you as a human, see you as a partner in reaching a particular goal. There's alternative language and approaches that we can use. And I do agree that we need to model it. And I think standing up when you can in different situations, how you do that looks differently. So I think you've touched on that, Dylan, and Bianca, you've also talked about it, but are there particular recommendations that you would have for everybody who's listening about terminology, about ways to write things down, about ways to correct people when they do use those things that you're talking about, Dylan? When someone says, oh yeah, well, they're schizophrenic, don't worry about them, they're crazy, what would you recommend?
So personally, I would recommend using very personal terms, individualized to the person, like young adult with experience, and never like crazy, but always just specific to what they're going through. I would remodel the whole thing altogether. I feel like that this world is so progressive right now that we are able to do it, but also if we don't do it, then people will still use those terms as if they were used in the 1900s, as if like my grandparents would look at that term. I can't talk to my grandmother about my mental health services because she doesn't quite understand. But I feel like if we remodeled the whole wordage, like everything about it, then yeah, that would be something that's more accepted and people would accept it more. Therapy is stigmatized, like it is really unfortunate, but it's something that it just needs remodeled. I'm not sure how I would go about remodeling it, but for the time being, I would try to take away all of the really general terms and try to keep it individualized to the person.
You actually gave us some terminology that I think could be part of this. When you talked about needing to heal from an injury or from trauma, both of which uses a little bit of that medical model terminology that people would understand, but also ties together that mind-body experience, because it is the whole person. You know, the mind is the only organ that we treat differently than the rest of your body. And so if you're talking about someone being in an inpatient program, you know, they're there for healing, you know, for a wound, for trauma, you know, for something that has broken or something that is injured. Yeah, I think that right there, that language might be a good start to how
Yeah.
we think about people.
If I was in a inpatient facility, I would rather be called a traumatized person that is trying to heal than a mental health patient. 100%. You know, it's not something where I'm going through my daily life and suddenly I just broke because I'm weak and I can't handle everything. It's because, you know, trauma and things have happened and my brain has developed differently and it's neurodivergency. It's not something that people decide, oh, I'm just done with life, so I'm gonna freak out. It's not something that people use drugs and then suddenly they're just different people. Most of the time people use drugs because of trauma. So
Mhm.
I think you're totally right.
If we're going to talk about addiction, I think next month is our next term. Bianca, what would you recommend from a parent perspective and from a peer perspective?
The first thing that comes to my mind is empathy. And if we can't have empathy, then we shouldn't be doing the work that we're doing. I think a lot of the times mental health professionals, they come with almost like check boxes. Like, you know, first I'm going to get all this person, I'm going to obtain all the personal information. That's step one. Then I'm going to get the past history. Then I'm going to do these assessments. It's like, check the box, make sure we do all these things. And sometimes we stray away, that it's been strayed away from compassion, empathy, grace, understanding, and not remembering that, you know, the humanization has sort of been removed, and sometimes it can feel like the robot, you know, like these are automatic type, I need to check all these boxes to do my job.
Mhm.
And in addition to that, because this is a client consumer and I'm obtaining finances from them, I need to make sure that I get all of this recorded appropriately so that when I submit it to this person's insurance, I get paid. Because at the end of the day, you know, not everybody does their job because of money, but sometimes people do. As a family support partner and a peer recovery specialist, I don't do this work for money because it's not very much, you know, and that's right now, it's not.
Another conversation, isn't it?
Yeah, and that's another topic for another day, you know, about how much mental health professionals are or educational, or, you know, people that are in this field are what their income is, you know, that's a whole nother topic. But as far as doing the check boxes or the robotic, let's just do this to get this done, it sometimes can remove the humanization of the rapport, the you know, let's put all these checklists aside and, like Dylan mentioned, making it more individualized. You know, this is Bianca's story, this is who she is. These are some really challenging topics that she's going to talk about that maybe she's never told anyone before. This is the first time she's saying this. And there can be a lot of movement through somebody's body when they are, you know, initially having conversations. And in my mind, I'm not thinking about someone else's agenda or their check boxes of what they need to get done. I'm thinking about, I've been waiting my entire life to talk about this so I can finally heal. I'm not thinking about how you're going to get paid. I'm not thinking about my insurance being billed. I need this to be removed from my body so that I'm not taking things out on other people. But with that, I require empathy. I require support. I require validation. I require just pure understanding. In order for us to have empathy is to hang our own experiences and all the things that we've ever known or heard about somewhere else, put all of our bias and everything else somewhere else so that we can feel and understand someone's story from their perspective, not the therapist, but from that actual person sharing the story. And if you've got your own agenda, or if it's a biased opinion, then that's not empathy. And so I think just being a peer and also a parent too, I've taken that word just in the work that I do, and everything that no matter what I'm doing, even being a parent or in my career, is just seeing it from trying to see it from someone else's perspective, and not really putting my own, being an observer, but also being an observer with my own thoughts. Like, why is this triggering me? Why is this, why is this triggering them? Even though it might not have anything to do with me. But I know that I wanted to say something really quick about Dylan, as far as, I started very young in the restaurant industry as well. And what I found is that I really liked serving. And what was interesting to me, I found true joy at bringing people food and because it's a basic need, right? It felt so wonderful to just give people, like, you could see people light up, even if they were hangry, you could see them light up when their food came or their drink or whatever you bring them. And I did that for 5 years. And it was kind of the segue into peer recovery work, because I thought, I love serving so much. I love serving the community, but I don't like serving food. I'm sorry, I'm going to be real. Because I've had to deal with so many people that were hangry, and the complaints was just so challenging. And so I realized that I did prefer the rewarding work as far as serving the community. And then as there was a lot of comments that stated Dylan be an excellent youth support partner.
Yes, I saw that.
I would agree with that. So my agency's hiring. I don't know which state you live in, and if you'd be willing to be.
I think you may have some other potential offers in this chat as well. Yes, so I think, Dylan, you're in Pennsylvania, aren't you?
Yeah, I'm in Pennsylvania, and thank you. You guys are so sweet.
Definitely some skills there. Let me ask you one specific question, Bianca. As a parent, if you were to look at your child's record, how would you want them documented? How would you want them referred to? What would be respectful of what they're going through and what you're going through as their parent?
As far as what they're called? I mean, child is sufficient. Youth or child.
Okay, so more of the role, I think, which is what also Dylan said, more of the role as opposed the role in the family. So the mother, the father, the caregiver, the child, the youth, as opposed to client or consumer, patient, that type
and
of thing.
that also gets sticky. As a former foster parent, I'm now have legal custody of my son. So there were some of the reports from 8 years ago, it'll say aunt. So that's a little also, so I'm a caretaker, right? So yes, I'm a caretaker of a kinship foster child. I'm not a legal guardian, but sometimes people put guardian because they automatically assume that you're the guardian.
Yeah.
But I'm not. I'm a custodial caretaker. I'm a kinship caretaker. So there's lots of different words that you'll see. You'll see aunt, you'll see parent, you'll see caretaker, you'll see guardian, you'll see custodial, legal, placement. There's lots of word. Or there, we could just simplify it as youth, child, parent, caretaker. I mean, we don't have to call it aunt, uncle, mother, father. It could just be caretaker. I mean, because that in the world, caregiver, because in the world of foster care, not everybody is the birth parent.
Yeah, that's so true. So true. I'm looking at our time, and I want to make sure we get to some commitments here from everybody that has been listening to your experience and suggestions, and thinking about the use of this term. So first, I want to thank you guys for being willing to share your experiences, your information, your recommendations, what you've seen work and not work, your expertise, to be honest. So thank you very much for sharing that today. And Dylan, I think you need to look into youth peer support. That is throughout this whole chat. You have a fan club. So before we go, let's just return back to those initial perceptions and the thoughts that everyone had about the use of client or consumer. But now think about what you just heard and what you've learned from our two discussants today about using these terms. And so I'd like you to do another Menti poll. The link will be in the chat box again. It's the same platform that you were just on, menti.com. You can see it on there. And if I want to know, what are some of the things that you're committed to doing within the role you have now to impact how client or consumer is used or not used? What are you willing to do to change this, to model this? I see some people have already answered. Adjust my own language, try to limit my use, which this does take a minute to change the way you do things. It's a habit that we've gotten into. I slip up all the time. I won't use the term client or consumer. I'll use the young people I work with. Confront it the next time I hear it. And call people by their name. Use their name. Use their pronouns. As people put things in, I'll see them. Even in the chat box, be more mindful of how we approach everyone as an individual. I loved that someone put in the chat about making sure when you're documenting, you are using that humanizing language, that person first language that's respectful, so that the next person reading that will be able to immediately start saying this person is an individual. Client neutral terms. Dylan, for youth peer support, it's like a trending thing now. We're going to have a hashtag.
I love it.
So someone's wondering about thoughts about using the word minor or juvenile. Either one of you have thoughts on that?
I've never been called either, but juvenile, I don't think it would go very well with many people, to be honest.
Yeah.
Well, yeah, I mean, it almost sounds like juvenile would have to be another words matter segment, because I actually do work with children that have been referred to the juvenile detention center and have probation officers. And so we work with parole officers. And so it almost feels like that would have to be a whole nother topic of discussion of the stigma surrounded by what juvenile means. As far as minor, it almost sounds like youth and child, and it just means underage adult.
Like a legal term. But yeah, and I'm writing down because we are going to continue this series into the next year. So I always learn something else we need to probably bring up. Okay, student, use my position to model and request change. Be mindful of what you put in records. Work how you change. Work to change how you speak to partners. And then asking people, what would you like me to refer to as? So those are all really good things.
And that last one is
Yes. Very.
And it's individualized and allowing that person to give you their preference opposed to assuming or opposed to just being conditioned to the medical terms.
Mhm. Yep. There are a lot of really good points made in the discussion in the chat as well. I appreciate how everyone has really interacted there and shared and supported each other with ideas and their own experiences. That's the purpose of this, is to start this discussion and to start to make change. So I love seeing all these different commitments. Thank you for completing that. Even if you want to close that one out, you can. Thank you. So definitely a change in kind of the tone of that after hearing from the voices of experience. So I want to thank everybody for joining us today, and we hope that you'll also join us next month. We're going to explore the term substance abuse or addiction. And in closing, we challenge you to be intentional in using terms that are more supportive and more respectful of the youth and family experience and their expertise. So thank you, and once again, remember that words matter. Everyone has a great rest of the week.
Thank you so much. Thank you, everybody, for all the support and the love. I hope everyone has a great rest of the day. It was nice to meet you, Bianca. Thank you, Millie.
Nice to meet you too. And Miss Sweeney, you have my permission to share information with Dylan as far as contact and how to, just explore the avenue of peer support work.
Yes, I think there may be some of those other ones all in here as well. So there are definitely some people in Pennsylvania.
You guys are
Thank
the
you very
best.
much. Have a good day.